Hi, welcome back. I am Naren, and in this vlog, we will check out how to get the COVID vaccine in India. In India, we are getting two vaccine types. One is Covishield, and another one is Covaxin. Covishield is the Oxford AstraZeneca vaccine, which is developed by AstraZeneca, which is a British Swedish company, worked with Oxford University for the vaccine. And in India, the manufacturer for this vaccine is Serum Institute of India, and it is known as Covishield in India. And the manufacturing target for them is around 50 million doses per month. And Covishield is made from weakened version of the common cold virus, chimpanzees. Whereas Covaxin, it is developed in India by Bharat Biotech, working with ICMR and NIV. And this manufacturer is not a new one. They are a vaccine maker for last 24 years with 16 vaccines in their portfolio and exporting to 123 countries. And their target of manufacturing is to hit 700 million doses by the end of 2021. And this vaccine is made up of killed coronavirus. And how do you get this vaccine? Like, the administration is through intramuscular injection, and you get it normally on your shoulder. And about doses, both of these will need 2 doses. Covishield, you will need 2 doses with around 4 to 8 weeks apart. On 23rd March, government suggested 6 to 8 weeks of gap for better results. And Covaxin, it's around 4 to 6 weeks apart between 2 doses. And note that both doses should be of the same vaccine type. You cannot mix one as Covishield and next one as Covaxin. And how do you get the vaccine? Like, you can register to get the vaccine through CoWIN website. There you can register with your mobile number and it sends an OTP to login. And once you log in, you can schedule a slot. Like, you can select the date and book an appointment. And at present, it doesn't allow you to pick a time slot. It's more about the day you will pick, and you will select a preference like morning or afternoon. And I'm assuming you will get an SMS later on if they're bunching few folks into a particular time slot, because one vial can be used for 10 doses. So they need to have 10 people to open one of the vials. And note that it is not mandatory to register at CoWIN to get your vaccine. You can directly go to one of the nearest vaccination center. But they will have limited spots even for registering through the CoWIN website or on spot. And there is no restriction that you have to visit a particular vaccine center for your location. You can register anywhere. And also you can get your first and second dose at different places, like different cities. But you should make sure that you will get the same vaccine type. And for in the CoWIN website, to pick a hospital, you need to enter the PIN. There is only search based on the PIN. Then you can select the date and the eligibility. As on 24th March, Any frontline workers or the health professionals, they can get the vaccine. And also people with more than 60 years of age can get the vaccine. And people between 45 and 60 years of age can get it if they have any comorbidities like hypertension or diabetes for 10 plus years and all. There is a complete list in Cowin website. And in this case, you need to carry a proof from registered medical practitioner to indicate one of those comorbidities while taking the vaccination. From 1st April 2021, there is no need of the comorbidity for anyone. Like anyone more than 45 years can take the vaccine. And the process, you cannot choose the vaccine type. You cannot ask for Covaxin or Covishield. But I think you will know before getting which one you are getting. Yeah, maybe then you might say no and try somewhere else. And the documents needed when you visit the vaccination center is the ID proof like Aadhaar card original or DL, PAN, passport. If you have registered through Cowin website, there you will mention which ID proof you will produce during vaccination. And if you're going through that comorbidity case, you need the proof for that. And you can also need to take the Cowin appointment slip if you have booked through Cowin. And if it is a private hospital, you need to pay 250 rupees. And if it is through government, it will be free. And there they will do the initial registration based on your ID, and then the vaccine will be administered. It won't take much time, but you need to rest for 30 minutes after vaccination just to check there are no side effects. And after vaccination, you will get an SMS on your mobile, which will have instructions how to download the vaccination certificate. If you see any side effects, you can report it to the vaccination center or you can call 1075. And this is the sample SMS that you will get. This is in Kannada language. I guess this is how you get for all people who are vaccinated in Karnataka, which will have your name and also the name of the person who administered you the vaccine and the place, date, time when you got the vaccine. And this will have the Cowin website link to download your certificate. And this is the sample certificate, that the PDF file that you will download. Note that the certificate will have your details and also the vaccine type, the name that was administered, and also when is the next one. In this sample, it says after 28 days you have to visit. Note that for the second dose, it won't be automatic, like based on the time gap and the when you took the first dose, you need to get the appointment, the second dose. I don't think anyone will track down to you and push you to get the second dose. Coverage as on 22nd March, I think 47 million doses were administered in India, which is the first 66 days of vaccination program. And about the vaccine diplomacy, India has sent around 58 million doses to 71 countries as like till mid-March. So if you get a chance, try to take the vaccine, and also don't forget the SMS, like using the sanitizer, wearing the mask, and maintaining the social distance. If this is helpful, please like, subscribe, and share. And thanks for watching.